When we think about PCIT, it was developed in the late 70s by Dr. Sheila Iberg, and it was initially developed for children between the ages of 2 and 7 years of age who had disruptive behavior problems. Children with oppositional defiant disorder, conduct disorder, attention deficit hyperactivity disorder, those meltdowns, difficulties in a majority of different situations, home, school, out in public, no matter what. Since then, it's really evolved. And now, PCIT is still for those children between the ages of 2 and 7, but it may be for a whole host of reasons. It may be for all of those reasons, and then when we look behind it, those behaviors could come because of trauma. They could come because of developmental difficulties. They could come because of parental drug and alcohol use. If we think about it, when PCIT first started in the 70s, a lot of those disorders related to children we didn't know about, trauma being one. So PCIT has been seeing kids with trauma since it started. We just didn't know what we were looking at.
PCIT is comprised of 2 different phases. The first phase is called child-directed interaction. And in child-directed interaction, we're working really hard to create a warm and thorough therapeutic bond between a caregiver and a child. We're working to give the caregivers positive skills to use to shape the child's behavior in a way that's loving and warm, but still has some boundaries to it, so that they're getting used to that. And kids can thrive because we're doing it through play. Then we're going to also move to something called parent-directed interaction, or PDI, which is the second phase of the model. And in PDI, we are really helping caregivers learn how to use commands effectively and have the control that they need in any environment so that they're predictable, consistent, and they're following through on what they need to do. And by the end of treatment, we have kids and caregivers who really enjoy spending time together, and they're successful in all avenues of life, at home, at school, and in the community. And they walk out oftentimes holding hands and giggling, and it's really lovely to watch.
The science in a nutshell tells us it improves behaviors, it improves relationships, it improves self-esteem, language skills, attention, focus, development, secure attachment, reduces trauma symptoms over and over again.
School behavior.
School behaviors get better without ever having to go to the school. It also changes behaviors in a positive way for untreated siblings in the home. It improves parenting stress. It improves parental depression. It's magical, and the nice thing is that we have the research to say, yes, it really does do all these things, and it does them well. There's phenomenal research on PCIT with high-risk families, families with children in foster care, families that have been involved in child protective services. So PCIT has research behind it saying, yes, it works for these families. And what we know is that for families that successfully complete this very short-term treatment, on average it's somewhere between 16 and 25 sessions, you're in, you're done. The gains made can last up to 6 or 7 years out because we've followed those families.
PCIT is traditionally done using 2 adjoining rooms that are divided with a one-way mirror. The family is on one side and they're playing, and the coach or the therapist is generally on the other side of the one-way mirror and using a bug-in-the-ear device to communicate with the caregiver. Also, PCIT has done a really nice job even before the pandemic of doing some research on using telehealth exclusively for PCIT services. And then many of us used it a lot during the pandemic as well, and still are using it today. So PCIT can be done really, really effectively using telehealth.
We've seen over the last many years a lot of people leaving the field. I think PCIT keeps us in the field because we see the changes, they happen quickly, and it is effective. We see changes in the child, we see changes in the caregivers, and we see changes in that relationship.
Every single time I do PCIT with a family, or even in consultation with our trainees, the progress and the gains and the joy that you see and that you feel from the families or from the trainee who is just experiencing it for the first time are just unmatchable. Like, there's nothing else that I've provided as a clinician that does exactly that same thing.
With our PCIT clients in the office, we have seen parents who have more confidence, who enjoy hanging out with their kiddo a lot more, who are more relaxed. We've seen parents come in with their own depression and anxiety and seen some of that ameliorate. We have seen clients who come into the office kicking and screaming and running down the hallway to being able to walk with their parent and hold their hand, to be able to follow directions, who seem to just be more emotionally and behaviorally regulated. I think the live coaching is the magic, because it's a lot different than telling a parent to go home and try things on their own that may or may not go the way that you envisioned. And so when you're sitting right there with them and coaching them through those really difficult moments, helping them to be consistent and regulated themselves so that they feel mastery over the skill you're trying to coach them into, and then that's going to help them to be able to replicate that at home when we're not around.